Breast cancer care is a model of shared decision making, and so it's really important for you to talk to your doctor, and that doctor should explain the type of cancer you have so that you understand your treatment options fully. All breast cancers are not the same. Patients will come to me sometimes and say, well, my friend, my colleague, my coworker had this same cancer and they didn't have to get chemotherapy. Why do I need chemotherapy? And so when you understand the type of breast cancer that you have, it's easier to understand why you need the treatment that you need, because cancer care is very, very personalized. I never discourage patients from doing their own research. It's important to go to reputable websites because there's a lot of misinformation about breast cancer out there. Some really great and reputable websites include things like the American Cancer Society, Susan G. Komen's website. There are others, advocacy groups as well nationally, that provide really solid information. And you got to talk to your doctor when you find those sites and if you have questions about what you've read. One of the really important reasons to bring your questions with you is because we all know how short the time feels when you're in that exam room with that physician, and you want to maximize that time. And so by having questions prepared in advance, you have the opportunity to make sure that that interaction with that physician is really robust and that you get all of your questions answered. You can ask your doctor about the availability of things like clinical trials. And I want you to know that's not a bad word. I think no one understands better than Black and brown individuals that there is earned medical mistrust. And we understand the historic basis for some of that mistrust. Black participation in clinical trials is less than 3% when we disproportionately bear the burden of disease. We are diagnosed later. We are not offered the most cutting-edge research and therapies to save lives. We have policies in place, we have review boards, and we have an entire team of folks in place to make sure that we're not taking advantage of patients, but instead we're offering them the latest, the greatest, and everything that they deserve to live long and healthy lives. It's super important for you to communicate with us so that we can know how therapies are making you feel, so that we can modify the dose if we need to, so that we can meet with you and come up with a different plan if we need to. There's probably no more serious event in life than a cancer diagnosis. And so finding the team that fits you, that is able to answer your questions, that gives you the support that you need, can help you to live the fullest life that you can live while you're on treatment.